Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, Medicare and Medicaid, two giant entitlement programs with funding problems. More on that in a moment, and then our popular journalist update, all to follow after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, as often is the case, we call in one of our experts, healthcare experts, in this case, Dr. Stuart Shapiro. He's president and CEO of the Pennsylvania Healthcare Association. Doctor, as always, welcome.
Nice to see you again.
Well, you're looking chipper here this morning, and unfortunately, we got to turn to a topic that, I just don't know explain this to me. 75 million of us begin this year to turn 65. That'll take place over 30 years or so. We've got these huge entitlement programs, Medicare and Medicaid, all essential to provide health care, in one case for the needy, in another case for all of us who are over 65, yet we have no plan to deal with that enormous social and fiscal problem. Am I right or am I wrong?
You are right. In fact, I've used the term a fiscal tsunami.
Yeah.
Because that's what it is. With the baby boomers turning 65, we have Medicare, we have Medicaid for the poor, and we have Social Security. But none of these is looking at how are we going to provide the long-term care for the elderly.
Right.
People are running from this issue and ducking this issue. And it's important that the Congress begin to address this, and it's really important that our presidential candidates begin to address this.
So, that's a good point. I think if I thought, and help me out here, I do the politics sometimes well, sometimes not well, but let's get to the heart of this. I think we ought to have a national debate next year over Medicare, Medicaid, and Social Security, and how we're going to fund them and what we're going to do about providing vitally needed health care services to the 75 million of us who are 65 or over in the next 30 years. Am I right or am I wrong about that?
You are, once again, absolutely right. In fact, I called for a presidential commission on this.
Right.
To address it in the same way that the commission by Ronald Reagan addressed Social Security in a very serious way in the 60s. In the 80s.
Right.
But it's very important that our presidential candidates look at this. They keep tinkering around the edges. And the cost of this are so staggering. And no one's looking at, in a serious way, how are we going to pay for the care? How are we going to use long-term care insurance? How are we going to use cafeteria plans where people work to have deductions? There are 15 or 20 potential solutions, and some of them have been proposed in legislation, but no one's seriously looking at this.
I think, I want to get on to some specifics, but my judgment is that they don't want to talk about these programs because one of two things will happen, and/or two things will happen. One, we're going to have to raise the money to provide the health care, that's the first thing, or we're going to have to cut services, benefits to people.
And we clearly can't do the latter.
Right.
Right now, nursing home services in Pennsylvania are adequate because we have enough nursing home beds, as an example. But as the baby boomers age, we're going to need more. Somebody's going to have to pay for this. Right now, Medicaid pays inadequately.
Right.
We have to take a look at, not just in Pennsylvania, but across the country, how we're going to address these serious funding gap issues.
Now, explain this to our viewers. Medicare, if you go into a nursing home, Medicare picks up the first 90 days, and then thereafter, if people have private insurance, that would pay for it. If they don't, then if they qualify, then Medicaid would pay for their stay. Do I have that about right?
About right.
Okay.
Let me give it to you real quickly.
Okay.
Medicare pays usually for people as they come out of the hospital for short-term rehab. And it pays fully the first 20 days. After that, the individuals have to pay some of it themselves.
Okay.
But it only covers it for 3 months.
Okay.
After that, the individual has to pay for it themselves, or Medicaid picks it up.
All right.
And when I say by themselves, that they may have
private
insurance.
Some kind of coverage,
but
right.
In Pennsylvania, 80%, or very close to 80%, of nursing home days are paid for by Medicare and Medicaid. The state legislature just passed a bill that would provide certain incentives to buy long-term care insurance. And the Rendell administration is just implementing that program. And that'll help down the line because people should buy long-term care insurance.
And I personally, about 15 years ago, I took out a long-term care policy. Not, you know, I don't know. I can't tell you I was aware as I am now. You know, when you get older, you seem to be more aware of. But your point is to everybody out there, if you can, and you're in your younger years, now is the time to think about that. Is that your point?
That is my point, and it's not right for everybody.
Right.
But you ought to talk to your insurance brokers, and it's really a very important safety net provision. I have some long-term care insurance, and I think it's a wonderful product to have. You got to be careful which one you buy, and there will be safeguards, but it's a very important product.
All right, when we come back from the break, I want to talk about specifically about the money that Pennsylvania is scheduled to lose in Medicare. There's still this big debate in Congress about what the final appropriation will be. I want to talk about that and also the Medicaid, the S-chip, the children's insurance part of it. We'll do that when we return after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back with Dr. Stuart Shapiro from the Pennsylvania Healthcare Association. We're talking about Medicare and Medicaid and the growing national crisis. I never use that word, or I use that word infrequently, but I'm using it now because I think that's where we're heading.
It's the proper use of that word.
All right, let's talk about something. Let's go into the Medicare situation right now in Congress, where we got differing bills in the Congress with differing funding amounts. President Bush has threatened to veto the bill which would reduce the funding for Medicare to the states. What do you see happening there?
Well, I think that we're really talking about the CHIP program.
Right.
And the Senate has proposed expanding this program to include more kids for about $35 billion over the next 5 years. The House has said, let's put in $50 billion over the next 5 years, and the president, unfortunately, has said, let's spend only $5 billion. The House version of the bill includes some real cuts in Medicare that could really harm the ability of the elderly to receive quality care in the future. And it's that bill that sets up something which I think is tragic, and that is an intergenerational warfare between those who support the elderly and those who support the kids. The Senate bill doesn't do that. And it really puts our representatives in a funny position. Do I vote for a bill that improves cares for kids but hurts the elderly? Or do I vote against a bill because it hurts the elderly and supports kids? And our representatives in Washington shouldn't be put in that position. America ought to have enough money to fund health care for kids and programs for the elderly.
That's right. Yeah, I misspoke when I asked that question. Of course, we are talking about the Medicare cuts that the states will have to absorb. I think it's something like $2.7 billion in Medicare payments for America's nursing homes as part of that. Is that right?
And I don't think of it as the nursing homes. I think it as of care for the elderly.
Okay.
And it is, and in Pennsylvania, it's about $150 million over a several-year period. And those are real cuts because it's Medicare that supports the state's underfunding of Medicaid. Because nursing homes lose $13 a day when they take care of the poor people in nursing homes. And frankly, when you put the blend in between then the few dollars that they can adequately make, it doesn't matter whether they're for-profit or non-profit on Medicare, that then evens things out so that they can stay in business.
Now, when you deal with S-chip and the children's health care program, which Pennsylvania has sort of vigorously been involved in for several governorships, this is a question of whether you can expand eligibility or reduce eligibility given the nature of the funding. If the funding isn't there, then one of the ways that Governor Rendell wants to expand health care coverage to the 900,000 or so Pennsylvanians is to include more kids in the S-chip program. Is that right?
You got that exactly right, and that's why it's so important that the House and the Senate get together and that they pass an extension of the S-chip bill, which will, because it will expand eligibility and it will guarantee funding going forward. And it's something that the Rendell administration has been very keen on, and rightly so, in providing health care for all kids.
That's
in
one
the
of the
state.
ways to, as I said, to work on the coverage in 900,000, and they can do that by expanding the income threshold. In other words, you can make more money in a family to have your kids eligible to receive S-chip insurance.
Absolutely, and the Bush administration has just proposed, in fact, other regulations that will cut back some of that eligibility. It is among the most hard-hearted, bad policies that have come out of this administration, in that it can really hurt and not allow the state to provide care for kids.
All right, but as we end this segment, regardless of what your position on is, I mean, this is an issue we've got to get resolved. I mean, Medicare, Medicaid, and Social Security, I think they're the huge problems. We somehow need to get a handle on them, or they're going to. It's a huge portion of our gross national product after a while.
No question, and it's very important that our presidential candidates
All
start talking about this in a very serious way.
As always, great update.
Nice to see you.
My pleasure. When we return, we're going to do a journalist update. What's going on in the state capitol? We'll let you know after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to Pennsylvania Newsmakers with two of the state's leading journalists, Pete DeCoursey, who's the Bureau Chief from Capitolwire, and John Micek with the Allentown Morning Call. John Micek, let me start with you. As this show airs, the computers are turned off. Licenses for hunting cannot be granted during this period. The background checks, I should say, more appropriately. It's created a huge flap between the governor of the state of Pennsylvania and the sportsman's community. Where does all that stand?
It reminds me there's no off-season anymore when it comes to Pennsylvania politics. I mean, this is one of the louder weeks we've had during the sleepy days of summer. State police announced they had to take this 25-year-old computer system down to do a badly needed upgrade because the only thing it was holding together was like rubber bands and willpower. Comes on the eve of dove and Canada goose season in the state. About 10% of the state's 1 million hunters are going to be affected by this.
100,000 folks out there in the field.
108,000 people out there who are going to be doing this. Huge uproar. Gun dealers, like everybody else, had planned Labor Day weekend sales. They claim the state threw a wrench into that. The governor put together an advisory council. They quickly huddled, decided what they're going to do. Instead of taking the system down from today through Thursday of next week, they're going to do it from today through Wednesday of next week in an effort to sort of minimize the discomfort for folks. But it was just amazing. There were accusations that this was a liberal conspiracy from Philadelphia to shut out hunters.
Yeah, let me ask you this. I mean,
this wasn't a liberal conspiracy.
Senator Scarnati, hold on, the majority leader used the L word. Didn't he? A liberal conspiracy by the Philadelphia gun. Go ahead.
This is not a liberal conspiracy, Terry. What this is we have a governor who is tone deaf to rural Pennsylvania. Imagine if the state police had discovered for some reason they had to shut down the Benjamin Franklin Parkway in Philadelphia on Labor Day weekend, and they were going to do it without asking anybody in Philadelphia. If John made the exact right words, they announced, the state police announced. Did they go and tell the gun shops, hey, we need to do something that will shut you down for 4 days. Can we work with you? But they announced it. They said, boom, and they picked a day. And now again, the simple fact is, if they tried to shut down part of the southeast economy on Labor Day weekend, Rendell will be hanging Colonel Miller from a tree. I mean, this is tone deafness, and the reason they stuck with it because Rendell thinks that this isn't that important. And out in rural Pennsylvania, where people hunt the way that he roots for the Eagles, this is important, and this is tone deaf, and he simply could have gone to the hunters and said to them, okay, you pick the 4-day period and you have 6 months.
It was just a screw-up. Somebody should have looked at the calendar. You know, something is always in season in Pennsylvania, so somebody's always going to be inconvenienced by this. But I talked to all of the affected constituencies. Even the Game Commission, which regulates hunting, you would have thought somebody would have put a call over there.
You know, just call and say, hey, is this a good 4 days to shut down the background check?
Yeah, the state police are heavily armed, so I can therefore assume that people over there hunt. No one asked them.
Maybe they don't hunt duck.
Well, no one talked to the sportsman's community. It was, it was...
So you think tone deaf?
It was a dumb thing to do.
Who you use tone deaf? You think tone deaf is about it? That they just I don't think
anyone really thought. I mean, they ran the sales numbers. They looked at the slowest week in September to do this, so they could do it. They picked this date. It wouldn't have killed somebody to pick up the phone and check.
All right, you get the final word on that, Peter. You get the first word on this business of the state does the budget 16 days late. There's all kinds of buyer's remorse after it, particularly on the tolling Route 80, to solve the roads, bridges, and mass transit problem. They're in something of a fight now, particularly the Senate Republicans and the governor. They got this huge agenda as they come back. What is that all about?
Well, first of all, they went through all this trouble to pass a bill that they think will spend about $1 billion a year over the next 10 years in new transportation money.
All right.
A little more than half to roads, a little less than half to mass transit. Now, having gone through that and having people like Senator Joe Scarnati from Jefferson County, way up by Punxsutawney,
who voted for it
and said this is the best we can do, Rendell comes back and on a very slight pretense, a couple of Republican congressmen, Phil English and John Peterson, threw a little wrench in the works and put a bill in Congress, an amendment into a bill that said you can't do this. That amendment's going to come flying out in September. But Rendell then says, wait a minute, let's have a fallback plan. Let's revive my plan to lease the turnpike. And
they're serious about that.
And he's serious. He's asked the companies they're going to get bids. Now, here's the thing. If you're Scarnati and you didn't want to lease the turnpike and your district is I-80, which they're going to toll under the new plan, runs right through it, and you took the hit.
Oh, yeah, we see this.
And all of a sudden you've got the governor, then the governor sent Greg Feit as chief of staff to tell these folks, look, we're only going to do this as a fallback plan. And now I asked Rendell last week, is it a fallback plan? He said, no, if the bid's high enough, I'm going to present it to the legislature.
All right, hold that thought. I want to get into some of these other controversial agenda items that the Republicans now may be more reluctant to vote for because of this dispute going on among Senate Republican leaders on the one hand and the Democratic governor on the other. We'll do that after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Builders Association, building today for a better tomorrow. And by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program with John Micek and Pete DeCoursey, journalists all, two of the state's leading journalists in to give us a little update. All right, John Micek, the governor has this huge agenda. I mean, Peter just talked about leasing the turnpike back on the table. We've got energy campaign finance reform. We've got a whole array of other issues. Are these folks going to be able to get into the room at negotiating time and work this out?
I mean, we were talking about this during the break, because I had a half dozen, 10 items that are up against them this fall when they come back. Big stuff. Open records, energy, you mentioned it all. And they've spent the summer staring at each other across the trenches. One can only wonder if they're going to be able to get it together.
Yeah. Well, okay, here's the point.
You got two groups now saying, I know I am, but what are you?
Yeah.
And then you're going to put them in a room, and they're going to come out. We haven't had property tax reform.
That's right. Still a huge issue.
Still a huge issue. For years we've been working on it. The idea of moving all 501 school districts into one health care plan.
Yep.
Campaign finance reform, which has been on and off the table for 40 years. A smoking ban. And these are folks who literally... They didn't know if they could trust each other with the budget.
And now
they believe they know they can't.
Yeah. See,
that puts all of these big issues at risk.
You got it.
And there's some major issues like open records reform, campaign finance reform, and smoking ban that actually affect people's lives.
Let me ask you the political question. Are Republican senators going to take a lot of heat from their constituent groups for voting for the budget, the 5.5% increase, which they'll argue wasn't quite that, even though there were no new taxes, John Micek? Is that what's at the heart of the problem? They went back home after the budget and after the tolling of Route 80, and now they got into some kind of political problem?
Well, I mean, it's obviously a problem. And they spent the entire spring and most of the early summer saying, no way, no new taxes, no new spending.
Yeah.
By God, we're going to hold the line.
And they didn't hold the line.
And they didn't hold the line.
But no new taxes, anyway.
But no new taxes. But still, that has to be explained away. And in those districts, that's not something that plays particularly well.
40% lower spending increase than any Rendell budget. The Senate failure was not in holding down spending. They held down spending more than most states, more than recent Rendell budgets.
But it's still
their failure was in public relief.
Increase.
No, their failure was in saying it was a 3% increase when you could easily show it was a 5%. If they'd come out and said it's a 5%, and 5's a lot better than the 7s we've been doing, they would have gotten away with it.
That's true. All right. In the limited time we have left, I want to ask you about, I think one of the hot issues, big issues, in addition to open records, which we've talked about before, but we've not done much, and we'll do in subsequent programming on this smoking ban. How big an issue, John, is this?
The smoking ban.
The smoking ban.
It's still a gigantic thing. States across the nation, 30-something, I think, at last count, we're looking at indoor public bans on smoking. Pennsylvania is one of the few holdouts.
Very popular.
Hugely popular.
Yeah.
You know, I mean, controversial, yeah, but hugely popular.
Yeah.
Philadelphia has its own ordinance. They took a couple of runs at it,
right?
Just before summer break, weren't able to get together.
Different versions out of each
competing
chamber,
versions,
yeah.
And it's sitting out there on the table.
All right, 45 seconds
NIMBY
left.
problem there.
You give me what's your top issue you think that they're going to try to do and maybe have a chance to do of this list?
Campaign finance reform.
You really think in Pennsylvania we're going to have campaign finance?
I think they're going to do something, even if they just make the reporting every 2 weeks.
Yeah.
Would be a huge improvement.
But that's a reporting law, not a real limit or not public finance.
I think they might do limits.
You get the last word. All right, thanks as always for coming in. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.